Good morning, we are live and we are barod, and I'm here in sunny Merthyr today, and I'm going to be talking to you a little bit about overdose prevention and more importantly the use of naloxone. So a bit about me first of all. My name's Kim Darkin and I'm the training coordinator here at Barod, and previous to my new role, which started in November, I was needle exchange coordinator for many years, so very much sort of at the front line of work, working with mainly injecting drug users. So I'm going to sort of bring a little bit of that experience into things today. So why is it important? I mean, overdose is the main cause of death amongst opiate users. And when I'm talking about opiates, I'm talking about heroin, tramadol, methadone, not just the, most people think of heroin, but, we're talking about sort of painkillers as well. And what we are finding through research is that most cases of overdose, there's someone else there. So there's someone there that could be taking action that could save that person's life. And this is what I'm here to stress today. This is an action that every single person could take to save a life. Just as a little example, I'm quite lucky with my health. I've got no allergies. However, if I'm with a friend and they suddenly get stung by a bee, they start clutching their throat, I have never been on allergy training. It's just commonly known knowledge that I know how to respond in that situation. I know to look for an EpiPen so I can possibly act and save that person's life. And this is what I want to stress today. Opiate overdose, a lot of people are dying through ignorance because the people around them don't know how to respond. If, like in the case of allergies using an EpiPen, if it's common knowledge, seeing a person, right, this could be an opiate overdose, this is how I need to respond, so many more lives can be saved and opiate overdoses can be prevented from being fatal. So the way this training works, what I really want to stress is that I'll talk a bit about the law later with regards to what is naloxone and who can have naloxone, but I really want to stress that when it comes to the training, it sounds quite overwhelming. You must be trained in naloxone. And what I want to put through today is that training can be so flexible. It could be, a day session where you have interactive activities, get a group of people together. It could be part of a key working session when you're working with an individual. It could be one friend to another, conversationally giving the information. So today I'm going to be giving you that information in 10 minutes, which first of all trains you to be able to provide naloxone should you need to in an emergency situation, but also it's giving you the knowledge to pass on, because certainly from my selfish viewpoint, my goal is to get everyone having that basic common knowledge of what does an overdose look like, how can I respond, and what do I do afterwards. If people have that information, then a lot of deaths are going to be prevented. So I'll go straight into it, and what I would love is give us a little comment or give us a little like if you're watching. We want to know who you are, where you are, and why this is important to you, and also how it could reflect in your life or in your work. And particularly if you've got any questions, we will be responding to questions obviously relevant about naloxone, so just throw them along in the comments and we will do our best to answer them all very shortly after the session. So first of all, I'm going to look at the risks of overdose. So who is at risk? Who do we need to be targeting with regards to giving this information? And unfortunately, older males are firmly in that category. The research doesn't suggest why. It could be, after maybe a long lifetime of using opiates and maybe other substances, maybe there's wear and tear, maybe people are taking more risks as they get older. If you've had a long history of any behaviour and you're not having negative problems, then you're going to get a bit complacent. So we're not sure why, but older males unfortunately are in that risk category. Injecting as well. If someone is injecting opiates, this is more of a risk. However, that is not to say that you can't overdose from, for example, smoking heroin. Because what a lot of people don't factor in is if someone's been using heroin throughout the day, for example, they may have been injecting 2-3 times throughout the day, that's still in their system. If they then smoke later on thinking it's only a smoke, I'm not going to overdose, it's still a risk, because although it may take a little longer to get into the system, it still gets into the system. So, it's really important that people don't have this in their head of only injectors can overdose, because it's really not the case. Polydrug use as well, and what I mean by that is people who are using more than one substance. So, for example, a person using opiates alongside alcohol use or benzodiazepine use. Now, alcohol is a really big one here. They're all depressants, they all slow the breathing down, and that's just going to have more of an impact. So if someone's using opiates and alcohol, that's a real concern. And while you may be walking past someone on a park bench, you may get a whiff of alcohol as you pass. You may think, they're passed out through alcohol. It could be that they've taken opiates and it's actually an opiate overdose. So this is why it's important to get that information out there. So now if you see someone, just what you assume, sleeping off the alcohol on a bench maybe, it'll be in your mind, actually, is this person overdosing? And it just gives you that little, indicator to think, I'm going to look into this more, I'm going to check that they're okay. Another risk factor is after a break. We refer to tolerance, which is how much opiates your body is used to taking. So if someone's using opiates on a regular basis, they may be able to take a lot more than someone who's never used it before, although that tolerance varies dramatically depending on the situation. So, for example, a person could go a few days without using any opiates. During that time, their tolerance will significantly drop. And if they were to then go and use the amount of opiates that they would usually use, that's a big risk, because all of a sudden their body is not used to that, and that could actually be enough to cause an overdose when usually, their body was quite used to that amount. So, people we really want to be looking out for and be concerned about are people who, for example, have come out of prison, come out of detox or rehab, or someone who's, maybe not used in a long time, and maybe, there are things going on for them and they've started struggling, and you're concerned that they may go back to drug use. So these are the things we would be concerned for. So if you work in the substance misuse field, you're going to be aware, for the most part, of what it looks like when someone is experiencing, A, enjoying the experience of opiates, let's say, and B, the difference between having that experience and it crossing over into overdose. But if you're not from this field of work and it's not something you're familiar with, the easiest way to describe someone using opiates is very drowsy, very sleepy. They may just appear to be sort of, in that halfway warm, fluffy, sleeping, not quite asleep, still mostly reactive, but, quite sort of, is what you're sort of looking for. Identifying the difference between that and someone overdosing, that is where it gets a bit difficult, because, we certainly don't want people going around jabbing everyone with naloxone just for having a nap on a bench. So it's quite, important that we know the differences, particularly around overdose. So the concerns we would be looking for with overdose is, the main thing is the breathing, because when someone is overdosing on opiates, their breathing is really slowing down to the point that if it continues, they will stop breathing. So things we would be concerned about is if we see someone with very slow, laboured breathing, you can see that it's difficult. It might be that they're taking slower breaths. It might be there are long gaps between their breaths before a big gasp of air, or they may have stopped breathing altogether. There may be a blue tinge around their lips, their fingers. These are all sorts of things that we would be really concerned about. However, the easiest way to identify an overdose is response. If someone is able to respond to you, whether that's, whether you're saying to them, I'm concerned, are you okay? Even if it's just getting them to give you a thumbs up, that's, they're at least then, they're still with it a little bit. What we would be concerned about is if, for example, you've seen someone who looks like they may be sleeping, you've got reason to believe they may have taken opiates. If you're approaching them and you're saying, I'm concerned for you, I'm going to give you naloxone. No one wants naloxone, and when we go into the training, you'll understand why. It's not a pleasant experience. It's going to kick out all those opiates that person has taken, and they sometimes can start feeling withdrawal. So if they're just experiencing opiates and not overdosing, they're certainly not going to not respond to let you know. They're going to tell you, no, I'm okay, don't give me that. If you tell someone you're going to give them naloxone and they don't respond, then that's normally a good indicator that they actually need it. So what is naloxone, first of all? Well, this is naloxone. This is a brand called Prenoxad that we use, but I'm going to refer to it as naloxone because I'm aware, if people are watching around the country, they may not have the same kits as us. So I may use Prenoxad, naloxone interchangeably, but it's essentially all the same thing. So what it does is it temporarily reverses the effects of an opiate overdose. So if you have identified someone with an opiate who's having an opiate overdose, you would use naloxone to bring them round from that. And it can now be prescribed out to people who are either at risk of opiate overdose, workers who are working with people that may be at risk of opiate overdose, and also carers that are caring for someone that may be at risk of opiate overdose. So this is the fantastic thing about it, is that, previous to naloxone coming about, if you found someone overdosing, all you could do was call an ambulance and wait for the paramedics. And while in an ideal world, they'll be there, instantly and deal with the person, you're essentially possibly got a loved one on the floor, not breathing. It's scary stuff, and waiting for that ambulance is going to feel like a lifetime. So what this can do is it gives you an action that you can actively take to save that life. But what I do want to stress is it's not a cure. It is not the case, inject someone with naloxone, they come back round, great, end of. It's not the case. This is just a temporary measure until the appropriate medical staff, the paramedics, can get there. So this is just a time saver. It's giving the paramedics that extra time. So the one big thing I really want to stress is no matter what is going on, always call the ambulance first, because that person, even if they come round, and I'll talk a bit about this a little bit later, they could still go back into overdosing. So it is so important that, people are calling the ambulance. Okay, so like I said, it could be given in a small portable kit so that people can actually come to us, any Barod base, which again, I'll go into this a bit later, and come and get a kit from us. So if you would like a kit, by all means, give us a little comment, tell us where you are, and we can message you with your nearest base so you can get that information. It's also important to know that this is unfortunately is not effective in a non-opiate overdose. So for example, if someone has taken a lot of benzodiazepine, so for example diazepam, this is not going to do anything. But the good news is it's not going to do any harm either. There is no negative impact of using naloxone. The only thing it does is have an impact on opiates. So if you found someone and you were concerned, pardon me, and you were concerned that they were experiencing an opiate overdose, you injected them and it turned out that they had not taken any opiates, no harm done. It's not going to have a negative impact because all it does is impact on the opiates. The easiest way to imagine this is a little analogy I like to think of, is if you imagine when someone takes opiates in their body, if you imagine there's a little bowl where the opiates are sitting, or a funnel. Funnel is easier to think of it. So as time goes on, the opiates trickle out, as they go through the body, they trickle out of the funnel. If there is enough in that funnel to cause a person to overdose, to slow their breathing, then they will. And what naloxone does is it's like a little grab machine from the fun fair, comes down, grabs a handful of those opiates and holds it. This is where the temporariness comes from. So a dose will take that and it will hold it. So meanwhile, the metabolism, and it's still going through the body, trickling out. So in 20 minutes time, when that naloxone wears out, that's going to release those opiates. And if there is still enough in that person's body for them to cause an overdose, then even if someone has actually come round, they seem okay, they seem like they're responding, without taking any more substances, they can actually go back into overdosing. And if you've used your one and only kit and you've not called the ambulance, unfortunately no help is coming. So this is why it is vital that we're calling ambulances. So what to do in an overdose? You've identified, you're concerned, you think someone's overdosing. The first step is a bit of a bizarre one, but go with me on this. Be selfish. Look after yourself. It's an emergency. If you go and injure yourself, then there's two people that need looking after, So, be aware. Are there sharps? Are there needles around? You want to be really careful. I mean, it's sad, but it could be the scenario that you found someone and they've still got a needle in their body and, they're passed out. It's not going to bite you. Safely, if you're able, take that needle and put it in the nearest sharps container while you're looking after that person. If it's on the floor, if it's out of your way, great. As long as you're aware, you don't need to go near it. You can leave it alone. If you haven't got a sharps container, a can of Coke, and others are available. Just using what you've got, be resourceful, but really look after yourself. This is the important thing, because if you're injured, you're no good to anyone, unfortunately. Secondly, we're trying to rouse the person. Tell them, I'm concerned for you. I'm going to give you naloxone. And again, if they don't respond to that, then they pretty much need it, because no one wants naloxone, especially if they're not overdosing. And again, calling the ambulance at the earliest opportunity. You want to be checking the breathing. These are things to be looking for. And when it comes to the naloxone, there are two procedures. One for if you've identified the person is breathing, but you can tell the breathing is really difficult, and another procedure for if the person is not breathing. It's not much different, so it's not complicated stuff, but I'm going to go through both for you now. So first of all, put it the right way around, the kit. So hopefully you'd have a kit on you, or if not, from watching this, if you've identified that someone's overdosing, you now know, right, this person might have a kit in their pocket. Or at least, if not, you know to ring the ambulance and say, I think someone is experiencing an opiate overdose. Their breathing is, the breathing is the key message. When the ambulances know that someone's breathing is laboured, they're going to get there as quick as they can. So it's so important that we are calling the ambulance. So the kit, as you can see there, I'll show you what it looks like inside. To open it, there's a little, can you see clearly? Yeah, getting the thumbs up there. You would rip I'm not going to open this because we don't want to waste a kit, but I have another dummy. So we're going to open that, wrap it round, and then, like a tea towel, we're going to twist. So I'll do that from that angle, twist. And then this is what it's going to look like on the inside. So first of all, we've got the instructions. These are really useful because, first of all, I'm not sure if you can quite see there, but it's got pictorial, really useful step-by-step guide. And the dual bonus of this is, which you won't see once I put it down, but it's a clean surface as well. So you've got all your instructions there, and you've got a clean surface to work from as well. So if you're not, if you've never injected, this is going to be scary stuff. There's no taking that away, but it's an emergency situation. It is an intramuscular injection. So, we're not medical staff. We're not going to be looking for a vein. We want to get it into the body quickly. So it's going to be going into a muscle. And the safest areas when you are injecting this is we're looking at muscle of the arm, which unfortunately, in a lot of cases when people are using opiates, often they could be quite slender build. So sometimes it's not always suitable to go in the arm. So personally, I would say the thigh muscle, literally where you'd slap your thigh for panto. It's a nice big muscle, and this will go through clothes. So only thing to be aware of is if someone's got a thick pair of jeans, it will go through jeans, but if someone's got car keys, wallets in their pocket, those are the sorts of things we'd be concerned about, because then obviously it could damage the needle. But it will go through jeans, it will go through clothing, obviously big thick coats. If you can ease them out, then you know, that is a bit more beneficial. But for the most part, it goes through clothes. So I'm going to give you a little close-up and hope I'm doing it right now. So on this kit, we've got 5 doses. So what you're doing, and I've got another dummy kit so I don't break the actual dummy kit. So you'd open it up and then you've got the little rubber bung there. So that would twist off. And then what you're left with is a barrel with 5 doses of naloxone in it. And all we're going to do is we're going to take, each kit comes with 2 needles within. We're going to take the needle out of the wrapper and and it's a twist. So we're just going to twist it on there. And that is now ready for the injection procedure. So we're finding the muscle, whether it's the thigh or the arm, and what we're going to do is, if it's direct skin, so say it's someone with a t-shirt or shorts, what we're then going to do is we're going to just stretch the skin gently and like a dart into the muscle. We're going to leave a little bit out because what we don't want is that needle going right up to the hilt. And the reason for that is because there's more surface area, there's more risk of bacteria and a bigger wound from the injection, and you know, we want to minimize the harm. So leaving a little bit out, we're going in, and this is the really important bit. It's an emergency and it is a scary situation, so while I can completely understand why someone may panic and put in a full 5 doses, we really want to discourage this from happening. As I've shown you there, lines 5, 4, 3, 2, 1. Each line is a dose. So we don't want to be throwing in 5 doses at once, and I'll tell you why in a second. So, first of all, if the person is breathing, ideally you've already eased them into the recovery position, but if not, just work with what you've got. You know, if they're slumped, for example, against something, then the arm, the thigh may be visible to you. But what we're going to do is we're going to inject to line 1. We're going to see how they are. Is there any change? It takes 2 to 3 minutes to start working, so we wouldn't expect, you know, it's not sort of an instant reaction. And I think what has sort of ruined this a little bit is a lot of people have seen Pulp Fiction and they've seen, you know, that big injection in the chest and the instant reaction. We're not injecting adrenaline. So first of all, we are certainly not injecting it into the chest, and we're not expecting instant. It's going to be more of a groggy coming to. But it takes 2 to 3 minutes to start working. So if they are breathing, 1 dose, give it 2 to 3 minutes, see how they are. If there's no change, repeat, 2nd dose, using the same. And the good thing about the kit is, I'll show you an empty kit there, is it's got that little handy cradle. So once you've done 1 injection, it can just be placed in there. And the other great thing is this is a self-contained sharps bin as well. So when you're done, you can just seal that up and that's good to go. Often the ambulance will take it off you because they want to know what's been given to the patient. So that's the process if a person is breathing, and just continue until they start coming round. And once they come round, if you haven't already, ease them into the recovery position, explain what's happened to them. Give them a bit of room, you know, because people can be quite disorientated when they first come round. But ideally, the ambulance will be on the way by that point and they can be looked after by the proper medical professionals. Now, if the person is not breathing, it's a bit different. What we would do then is we'd want to be getting them flat on their back, 30 chest compressions, 2 rescue breaths if you are trained. If not, the chest compressions will suffice, followed by a dose in the same way I explained earlier. Repeat, 30 chest compressions, 2 rescue breaths if you're trained and able, followed by a dose, and repeat until they come round. And again, it's so important that the ambulance has already been called, because otherwise, you know, I saw on first aid training, there was a fantastic example where we were asked to do our CPR on the dummy, and we were shown how to do it, and you know, we all started doing it, and away we go. We're practicing and we're doing our practical doing that, and someone asked the instructor, how long do I do this for? Have you called the ambulance? Obviously it was in mime form because, you know, we were on training, but if you haven't called the ambulance, no one is coming. So you have to do that until they come round, which could be a long time. So again, I just want to stress, call the ambulance. It is so, so important. And again, once that person is coming around, really encourage them. First of all, they may be withdrawing, they may be in pain. It's about, encouraging them. They could still become poorly again without using any further substances. So it's really about encouraging them to stay and see the medical professionals. And then, you can just seal your kit in there. Like I said, it's a little self-contained sharp spin. And then you're looking after the person and encouraging them to get that proper medical care. So that's how to respond in an overdose. What else did I want to cover today? So how do you get a kit? This is the main thing. It's all good and well knowing how to respond and what to do with your kit, but if you don't know how to get it, then it's pretty not useful information. So you can get a kit at any of the Barod bases. If you give our Facebook page, We Are Barod, a little look, on there we've got a long list of all of our bases across Wales, right from Aberystwyth all the way up to Newport, and everywhere in between. So give it a little look. If you want a more personal response, drop us a message, drop us a comment, and we are happy to tell you where your nearest base is. Or drop us a private message if you'd rather a private chat with one of our staff. And just come and get your kit. I mean, the main thing for me is, as well as getting a kit, it's about the information. Whether it is just taking the time to just tell one person in your life, do you know what, I watched this video the other day, have a look, it's really useful. Or passing this information, if you see someone that is collapsed, and a lot of people sort of say in my life sort of say to me, well, I don't know any heroin users. When would I use this information? Well, for example, I've never had a stroke. I don't know anyone in my life who's experienced a stroke. However, I know what to look for. From the FAST campaign that was all over Facebook and the media, I know how to respond if someone is having a stroke. And it's exactly the same with opiate overdose. You don't have to know anyone in particular that is using opiates. Anyone could be walking through the street and find someone on the floor. Just having this information, it just gives that little bit of, awareness. This is what it could be. This could be one response I could take. And again, to highlight, if you found someone and it turned out that maybe they had just used alcohol or diazepam, it's not going to do them any harm. You have acted to try and save their life. And, the law states and this is something I should have covered earlier, the law states any member of the public can use naloxone to save a life. So what this means is, while in order to get your own kit to carry with you, you must have received training, which the good news is you just have. You've literally just been trained. While to get your own kit, you must be trained and demonstrate that you know how to use it appropriately. In an emergency situation, any member of the public, anyone in the world could think, I haven't got naloxone, but do you know what? This looks like an opiate overdose. This is what it could be. If you can see this sticking out of someone's pocket, it's a nice bright yellow, you can't really miss it. Or even just having that knowledge to find someone on the floor and go, has anyone got naloxone? This is what's going to save lives. Just having that little bit of awareness, and that is really what I want to stress. If every one person that has watched this video commits to talking about this to one other person, then it's extended the spread. Let's be ambitious, go for 5. Speak to 5 friends. Just make them aware of A, what does an opiate overdose look like? B, how to respond if you have naloxone, which is the ideal situation, but also if you haven't, just knowing this could be an opiate overdose. I'm going to call the ambulance, I'm going to watch for their breathing, and how to respond is so important. So again, we're going to be doing a lot more of these videos. This is the first one, so if it's ropey, I'm sorry, but it's my first go. We're going to be doing a lot more. So if you've got any if you've got any ideas for what you'd like us to cover, please throw us a comment. But for now, that's me done. I'm Kim Darkin. We are Barod. Thank you so much for watching.